Somewhere in Africa's past, before the guns, the shackles, kidnapping of storytellers, sky readers, musicians, dancers, doctors, sculptors, teachers, planters, hunters, historians, mothers, fathers, and children, they were the women who caught the babies and guided them into the world with their gentle hands. The history of black midwifery dates back 403 years to when enslaved Africans were forced to arrive to America. African midwives were a subset of this population who brought their knowledge of women's reproductive health. Enslaved midwives were birthing everyone, both enslaved and white babies. As a result, many people proclaim that black midwives birthed and nursed America. Black women dominated midwifery until approximately 1900 when anesthesia was introduced, which led to an increase in hospital birth rather than in-home birth. It became more profitable for America to birth its babies in hospitals. This was the first step away from midwifery. As medical practices transitioned, the requirement for black midwives unfairly changed, and they were systematically forced out of midwifery. To increase hospital profit and increase control, many white male physicians began discrediting black midwives. They promoted a narrative that these midwives were unsafe, unsanitary, and lacked training. These physicians stripped power from the same women who helped birth this nation. They undermined black midwives' credibility and brought white public health nurses into the South to supervise them. As a result of these inequitable practices, black midwives to this day are extremely underrepresented in the birthing space. Black midwives were forced even further to the margin in the 1930s when there was a rise of white midwives training in England and bringing a nursing midwifery model back to America. Many black women were excluded from participating in this new model. The evolution of racial segregation and injustice in maternal health through the 20th century reflects the same injustices running rampant throughout all of American society. By the 1960s and the 1970s, the effect of civil rights movement promoted a stronger impetus to get black midwives into these training programs. To this day, of course, the irony giving black women are pioneers in this space. As we honor our ancestors who were trailblazers in midwifery, it is also critical to uplift today's black women who are fighting to reclaim birthing spaces. There is a dire need to reclaim our tradition, our legacy, and caring for our own people. The hallmark of midwifery in their acute attention and care when listening to people. When it comes to black patients, who can listen to these sisters better than providers from our own community? Midwives play a critical role because they respect mothers' desires for their care by centering their voices. It is time to put black maternal health back in our hands.
Let me see now. Bed made fresh, newspaper pads ready. I wish to goodness all my mothers could have everything fixed up this nice. I'll have to move the bed over to get under that light. Baby tray fixed. Gonna move that table down this way to lay out my things on. He even got the slop jar fixed on the paper. Oh, look at them pretty new shoes. Look like Tom done bought somebody a present. Let's see how you doing, Ada. You are fine, but it ain't no hurry. He weighs 8 1/4. I didn't miss my guess much.
I looked up to heaven and I won't deny it. Hallelujah, amen. Gonna have my baby back.